Multiple sclerosis. MS is a neurological degenerative disorder of the CNS characterized by demyelination of the nerves of the brain and spinal cord. So in a normal neuron, there's these things called myelin sheaths, which are mainly located in the CNS that allow rapid conduction of electrical impulses within the neuron. In an MS neuron, however, the immune system attacks these sheaths, causing them to become defective. So eventually you get a defective electrical signal that travels throughout the neuron as well. So symptoms and signs. Common symptoms are weakness and double vision, physical fatigue, balance, gait, which is the way you walk, pain, and mental fatigue. Some signs are dysarthria, which is trouble with joints, nystagmus, which is rapid eye movement and back and forth, intentional tremor, which is shaking, and Lhermitte's sign, which is the sensation of an electrical impulse traveling down the back. So in the US, 90 out of 100,000 people have this disease, and the age range is between 20 to 40. And it's also more common in females. And it's more common in the US as well, especially in areas away from the equator. They think it has to do something with the temperature and the amount of sunlight. So if your mom has it or your dad has it, you're more at risk of getting MS, so it's hereditary. And also if you smoke, so smoking is also a risk factor. They've also found a correlation between some viruses. And like I said before, if you're female, you're also more at risk. And if you live in areas where there's a temperate climate, then you're also more at risk because it's away from the equator. So some diseases associated with this is asthma, inflammatory bowel disease, diabetes mellitus type 1, anemia, and autoimmune thyroid disease. Some other symptoms and complications include things like depression, overreactive bladder, so incontinence, and muscle stiffness, paralysis in worst cases, epilepsy, mental changes, and sexual dysfunction. So in a clinical setting, you'll notice that these patients' reflexes are hyperactive, and their vision will also be defective, so they have kind of like a defective vision, and their coordination is also affected. You notice that when these patients walk, they seem to stagger. They'll also have stiffness in extremities, skin breakdowns, and musculoskeletal complaints. Many patients, if not all patients, have these type of complaints. So how do you diagnose this? The first thing to do if you suspect a patient with MS is to do an MRI. And the MRI will detect for white matter plaques, which are these things right here in this MRI on the right-hand side. And the white matter contains myelin sheaths, so neurons that are myelinated, and if these are defective, then they show up as plaques. And the second thing to do is a CSF, so a spinal tap to locate some antibodies. And the third thing is probably a visual evoked potential, which measures a response to visual stimuli. And patients with MS will notice that their response to stimuli is very low. It's very defective. So treatment, there's not really any treatment, but there's also treatment you can manage it with. There's immunosuppressants to block out T cells, so kind of control the immune system and lower it. Corticosteroids are also another thing. Cyclophosphamide and intravenous immunoglobulins. Of course, there's also physical therapy. Vitamin D is also given because they've noticed that patients with MS usually have a deficiency of vitamin D. And there's still being research done about this, but they think that the deficiency with vitamin D has to do with a higher risk of MS. So there's different types. There's benign, and benign, you don't really have MS, it just goes back and forth. Relapsing and remitting goes back and forth, but then it gradually progresses. And secondary progressive goes back and forth again, but then again it increases gradually, rapidly. And primary progressive MS, which is the worst type, which progresses rapidly very quickly. So this is a clinical case study that I put together as a review. But this is a 35-year-old female that came to the clinic, and she has signs of heat tolerance, stumbling gait, and tendency to fall. She has noticed significant changes in her vision, and 3 months ago, she had flu, and she noticed that there were significant tremors and extreme fatigue. And an MRI expressed that multifocal white matter in her CF shows antibodies. So this is a very classic clinical case study of MS.